Usually the first symptom of scleroderma is the development of Raynaud's phenomenon, and this is a temporary disruption of blood supply to the extremities, and that's triggered off by changes in temperature or emotional stress. Now, if I was to stick my hand in a bucket of cold water, the blood vessels around my hand would shut down to try and conserve heat, and my hand would go cold and white. The problem in Raynaud's phenomenon is that it happens very small changes of temperature or in situations of stress. Raynaud's phenomenon itself isn't necessarily abnormal. It's very common, particularly in young girls. It can come on in teenage years, and some people believe that up to 1 in 10 people can have Raynaud's phenomenon and actually not be unhealthy. We tend to worry about this though when it comes on as an adult. When this happens, it may be the first sign of a connective tissue disease such as systemic sclerosis or scleroderma. In this situation, I think it's helpful to get checked over by a doctor to see whether there are any factors that might link it into scleroderma. And when we look at patients with adult onset Raynaud's phenomenon, the things that we're looking for are, there's a variety of issues. First of all, are there any symptoms or findings on examination that might suggest a connective tissue disease such as systemic sclerosis or scleroderma? We also want to do some simple blood tests to see whether there are any autoantibodies that can be linked with systemic sclerosis. And also some other things such as doing a special X-ray around the neck to see whether or not there can be any trapping of blood vessels as they come out of the chest into the arms, because rarely they can be associated with Raynaud's phenomenon. So Raynaud's phenomenon as a youngster is usually nothing to worry about, and only a tiny number of people that develop it young will go on to get connective tissue disease. But when it develops as an adult, then there's a higher chance of it being the first sign of a connective tissue disease. Still, it's only a minority of people that will go on to get that, but certainly we want to investigate it to keep an eye on people and try and detect the development of a connective tissue disease at an early stage. There's a number of different types of scleroderma. It can either be localized or it can be diffuse, affecting lots of different parts of the body. Localized scleroderma can be in small patches such as morphea, or in a slightly wider pattern of coupe de sabre. It might also be associated with systemic problems, in which case we would tend to divide it up as being diffuse cutaneous disease, where it can affect lots of different parts of the body, or limited cutaneous disease, where it tends to affect the extremities of the body. And the systemic forms of the disease can be associated with internal problems in major organs such as the gut or the heart or the lungs, whereas the localized form of scleroderma tends to only affect mainly the skin and isn't associated with the problems that the systemic form of the disease can have. The limited cutaneous form tends to have a much better long-term outlook because there's less problems internally, but the diffuse cutaneous form can sometimes be associated with much worsening problems inside. The most common symptom of systemic sclerosis, and usually the first one that occurs, is that of Raynaud's phenomenon. However, patients can also notice other things which are associated with the disease. It may be that they notice the skin feeling tight or puffy or a little itchy, or it may be that they notice symptoms from other organs that are involved, not just the skin. For example, there can be heartburn with the esophagus or gullet being involved. There could be problems with diarrhea or weight loss, or even constipation as other parts of the gut get involved. And some patients feel very run down and tired. It's important that patients who are diagnosed to have systemic sclerosis are seen by a rheumatologist. It's also important that patients that have got troublesome Raynaud's phenomenon are assessed by a rheumatologist. That's for two reasons. First of all, we might be in a position to make a diagnosis of systemic sclerosis, but also we're in a position to provide good treatments to help with the Raynaud's phenomenon. Once a patient has known to have systemic sclerosis, then it's very important that rheumatologists can keep these patients under general review. And that's important both to help deal with the symptoms that can be a problem with the disease, and also to try and protect important organs such as the kidneys and the heart from being involved or damaged at later stages. Many doctors need to be involved in the care of patients with systemic sclerosis, but we'd see the rheumatologist as being the leader of the team who coordinate the care from the other doctors and be primarily responsible for looking after the patient.